request to record. Thanks.
It says recording, so somebody did something.
Beautiful. All right. Let's hope we could find it. Okay. Hey, welcome everybody. Happy snowy Sunday.
Indeed, we finally got that snow. Oh.
I know. Today we are welcomed with Dr. Henry B. Perry. He is a distinguished global health researcher and physician specializing in community-based primary health care. He holds an MD, an MPH, and a PhD from Johns Hopkins, where I believe he currently serves on the faculty at the School of Public Health. His work focuses on improving maternal, neonatal, and child health through community-oriented programs in resource-limited settings, with particular emphasis on equity, empowerment, and health systems strengthening in developing countries. So I will hand it over to Dr. Perry.
Okay, very good. Thank you very much. And it's good to be with you all. Thank you, Kate. Can you hear me?
Yes.
Yes.
So this is a special moment for me, but unfortunately it's a small crowd, but we've got a few people here that I'm really happy to share this experience with you in this video in particular. Let me see if I can get my PowerPoint going here. So just a second. Can you see this?
No.
Not yet. There it is. It's up now.
Okay.
Yeah.
Okay. Okay. It's here. Good. So I had the great privilege of knowing these two people, Raj and Mabelle Arole, whom I'm referring to here as Christian pioneers in global health. They were extraordinary people, as you'll soon find out about. Mabelle's father was a professor of New Testament studies at a Methodist seminary in India. And I was amazed to find out recently that he was actually on the faculty at Duke Divinity School for a short period of time back in the 50s, early 60s. And I don't have time to tell you how I got involved with them. I wish I did, but there's a lot to this story. But they were pioneers in, among many other things, the formation of community health workers in India and in fact in the world. And these are the pioneering initial group of community health workers that the Aroles trained to provide health care for the villages in this very underserved remote area of India called Jamkhed. After 20 years of this work, they wrote this book, which has become one of the great pioneering textbooks, really, about global health, that's been published in many different languages and has been read all over the world. The introduction to this book says the following, and I can't read part of this because the photographs or the videos of our faces are blocking this. Is there some way to do that? Oh, hang on a minute. Oh, yeah. Okay. The introduction to the book was written by Carl Taylor, a man I've had a long connection to. He said, a remarkable quality of the Aroles in their work is their deep humility. While promoting change that most revolutionaries would not attempt, they do it in a way that empowers and gives recognition to the people. The most authentic of their personal characteristics is that everything they do is grounded firmly in their Christian faith. They are quoted as having said, our religion is what we do. They are among the best of the models in the world today of religion in action. So I'm going to turn this over to Nelson, who is going to play the video. We've been going back and forth on this. It looks like the best thing to do is for me to stop sharing and for Nelson to play the video from his computer. And make sure that all your volumes are all the way up. It's a little bit quieter than we would like.
There are 650 million people in India. 80% of them live in villages largely untouched by the advances of modern science, technology, and medicine.
This was made in the early 1980s, by the way, by the BBC. Can everybody hear this okay? Good.
Yeah.
Poverty, illiteracy, superstition, and taboo dominate daily life. Health in the villages is poor. Children die of diseases long forgotten in the West. Adult life is often blighted by cholera, TB, leprosy, and blindness. India trains 10,000 doctors a year, but few of them want to work in the villages. City life is easier and financially more rewarding. This film is about two doctors who rejected the easy option.
तुमच्या वाशा बिशात खात नाही तुम्ही परीत लोक आईकडे राहिल्यामुळे तिने दूध तोडलं ते बाळाचं तिचं दूध तोडलं आणि वरचं काय खायला दिलं नाही समजलं की नाही असं मोठं काय झालं नाही तुला बरं कशा रडती तुला काय झालं
10 years ago, Dr. Rajnikant and Dr. Mabelle Arole started the comprehensive rural health project at Jamkhed. The project now operates in a cluster of 70 villages in a remote part of Maharashtra, 200 miles east of Bombay. The hospital is equipped to deal with acute illness and surgical cases, but it's the least important part of the project. The Aroles believe that India's rural health problems can be solved only by rethinking medical priorities. Health, they feel, is everyone's responsibility and not the preserve of the medical profession.
What medical science is today is actually a pool of the experiences of many people. It is a common pool of knowledge. And I do not think that this pool of knowledge should belong to one particular set of people. That is the doctor. I do not think the doctor should have a monopoly of that and then make use of this common pool of knowledge to make money for himself.
What we want to do is make this health knowledge available to everybody. And in doing so, create new manpower who will be able to understand these things in a simple way and apply this knowledge to the people on a massive scale. Because few doctors or few health professionals scattered here and there will not do. The main element that is necessary in taking this knowledge is not a technical ritual of giving a pill or an injection. It is transforming people's thinking, is giving education to the people. And the educational processes can best be given by the people who share the culture of the people, who share the life of the people. And that means these are the local village people.
The Aroles are training illiterate women in basic medicine and health education.
माझा पटून किती सांगायला पाहिजे रुपयात किती आणि पटून द्यायचं काम आहे 15 आणि पटवायचं काम आहे आणि एक आणा फक्त डॉक्टरचं कापायचं काम आहे की नाही कोण सोडायचं काम आहे आणि शिकवायचं काम कोण करेल तुम्ही करा म्हणजे गावातले माणसं म्हणजे कुटुंब नियोजनाचे जे कार्य आहे ही कुटुंब नियोजन मोहीम आहे हा दवाखान्याचा काही पण भाग नाही दवाखान्याचा डॉक्टरचा फार छोटासा भाग आहे याच्यात
Certain technology does need skills and more knowledge and perhaps more talent, and such things should be the doctor can keep, but most of it he can share with others.
Inability to read does not at all mean lack of intelligence. In fact, I think our village people have to live by their wits all the time. So they have to keep their eyes and ears open. And therefore they have to be very good observants. Because everything that is happening in their field, what is happening to an animal, when the cow comes on heat, when the goat is likely to get sick, they have to be very careful because their very life sometimes depends on these little events. And this, their ability to observe, helps them also to learn skills in medicine and other things.
काय मावशी काय भाजी केली कालवर बोला ना मावशी किती मुलं आहेत तुम्हाला मला हा मला एकच आहे मग आमच्या जवळ ना आणि बाळाचं सगळं काळजी घेतल्या जाते आणि बाळाला काय होतं आजार येत नाहीत कोणते आणि आपलं बाळ काय राहतं तंदुरुस्त राहतं BCG नावाची लस असते आमच्याजवळ ती 20 वर्षापर्यंत देतात आम्ही ती BCGची लस घेतली पाहिजे म्हणजे आपल्या बाळाला शिकवलेलं आहे सगळं दवाखान्यात मग तुमच्या बाळाला आम्ही सगळं समजावून ही आजार येणार नाही ही भाजी खाऊ घालायची ती कांदा खाऊ घालायचा ही घालायचं ही मोड आलेलं आहे
प्रकल्पाने आरोग्याच्या दृष्टीने आम्हाला काही माहिती दिली त्यांनी सांगितलं की बुवा एक गावातली तुमच्या मुलगी साधारण 6वी 7वी शिकलेली द्या तशा दृष्टीने आम्ही यमुनाबाई म्हणून एक मुलगी दिली की जी मुलगी कधी गावामध्ये आमच्या समोरून जात सुद्धा नव्हती आणि ती प्रकल्पाने जेव्हा तयार केली तर आम्हाला फार मोठ्या डॉक्टरपेक्षा ती फार मोठी डॉक्टर आम्हाला वाटते कारण बाहेरचे शिकलेले सवरलेले डॉक्टर आमच्या गावात येऊ शकत नाहीत खेड्यात येत नव्हते पण ही जी नर्स आमची तयार झाली त्यामुळं जुन्या चालीरीती जुने काही विचार काही असे गैरसमज होते आमचे काही आजाराच्या बाबतीत ते सुद्धा त्या मुलीनी इतक्या चांगल्या प्रकारे काढून टाकले लोकांच्या मनातून आणि आरोग्य काय रोग कशामुळे होतात साथीचे रोग कशामुळे होतात लहान मुलाचं आरोग्याचं संरक्षण कसं करावं, गरोदर स्त्रियांच्या आरोग्याचं संरक्षण कसं करावं, बर्थ कंट्रोल कशासाठी करावं, म्हणजे कुटुंब नियोजनाच्या दृष्टीने कसं वागावं, अशा सगळ्या दृष्टीचा विचार करून त्या नर्सने आम्हाला आरोग्याच्या दृष्टीने गाव परिपूर्ण बनवलेलं आहे. आम्हाला डॉक्टर नसला तरी चालेल अशी परिस्थिती त्या नर्समुळे आमची झालेली आहे.
ऑपरेशन आहे, आपल्या बाळाचं आरोग्य चांगलं राहतं आणि
In Godegaon village, 15 children used to die every year of malnutrition, gastrointestinal infections, smallpox, cholera or tetanus. Last year, not a single child died.
The West has already licked most of the problems that really exist in India today. For example, the infant mortality here is very high, and the cause of this high infant mortality is really due to bad sanitation and the diseases caused by infections, which can be prevented by immunization. And of course there is the major problem of poor nutrition, and it is these three factors which are producing ill health.
The health problems that cause death and suffering in the villages are not very exotic. They are not such that they need very expensive technology to detect them or very expensive people to treat them. They are very simple, related to basic things of life.
आवडतं ना तुला शिरा? काय झालं? कोण? बरं नाही.
Child malnutrition is a chronic problem. In every project village, the health worker runs a daily feeding program. This ensures a basic minimum protein intake for children at risk. The food is contributed by the local farmers.
लहानपणी तर वडील वारलेले एक मला कळत नाही, आणि वडील वारल्याच्या नंतर माझ्या आईने आणि माझा एक लहान भाऊ घेऊन देशाला गेले, आणि देशाला गेल्याच्या नंतर माझं लग्न केलं. लग्न म्हणजे मी जवळजवळ 10 वर्षाची होते तेव्हाच केलं. कारण पहिले पूर्वीचं म्हणायचे, आई आमची म्हणायची मी विधवा झाले मग मुलगी सुद्धा लवकर देऊन टाकावं, कारण गडी माणूस नाही सांगते. आणि मग मी गरोदर राहिल्याच्या नंतर बाळातपणीच टायमाला इतका त्रास झाला की समजा 2 दिवस सहन केलं, आणि तिसऱ्या दिवशी काय झालं म्हणजे समजा यातना तर सुरू झाल्या, आणि यातना सुरू झाल्याच्या नंतर ते बाळ अगदी तिसऱ्या दाराला येवणीच्या तिथं बाळ ते अडकलं गेलं, आणि येवणीच्या तिथं बाळ अडकलं गेल्याच्या नंतर मग मला कळा सुद्धा यायच्या बंद झाल्यावर मग मी झोपून राहिले. मग आई माझी घाबरली, आणि मग आईने ते एक सरकारी नर्स होती त्या नर्सला आणलं, आणि मग एक खेड्यात तिथं दवाखान्यात 2 बायाने वरनं असे हे करून दाब देऊन ज्या दिवशी डॉक्टर तुम्ही ते डिलिव्हरी केली का, आता आमच्या डोक्यात जरा विचार यायला लागला. आणि मग नंतर ते बाळ एकदम डोक्यापासून 3 भाग केलं, ही कवची काढल्या गेली, ही काढल्या गेलं, ही काढल्या गेलं, नंतर 2 हात काढल्या गेलं, आणि मग ते बाळंतपण झाल्याच्या नंतर मग पुन्हा मग नवऱ्याला तर ते नको वाटेल का नांदायसाठी, म्हणलं प्रत्येक टायमाला जर असं खर्च जर आला तर कसं काय करायचं त्याला.
I came back to the village to live with my brother and sister-in-law, and together we went looking for work. I'm a Harijan, which means I belong to the untouchable caste. It's hard for Harijan women to earn a living, and I had to work on a road building gang. It was hard manual labour, breaking stones, carrying gravel and so on. But the worst problem was water. Before the project came to Rajuri, there was no pump, and we Harijans were not allowed to draw water from the village well. We had to ask higher caste women to draw water for us and pour it into our vessels. Very often we had to spend the whole day looking for someone who was willing to do this. The high caste women would say, "Why should we bother drawing water for you?"
In many villages, a previous untouchable may not be allowed to draw water from the village well. Now, supposing a child is having skin infection, scabies, impetigo. Now, the main reason why the child got the skin infection is because the child was not kept clean. He did not have a bath. Now, I will give you an episode that here was a woman bringing her child with scabies, her children with scabies. And one day I shouted at her and I said, "Can't you just wash your children?" And she also retorted. She said, "What can I do, doctor? In my village, the villagers will not allow me to draw water from the common well. And I have to go a mile to fetch water. Now, shall I fetch water for drinking or shall I fetch water for bathing these children?"
Access to clean water is essential. With government help and money from Oxfam, the Aroles have arranged for wells to be bored in the Harijan sections of the project villages.
One day, the village watchman came to my house. He told me that the village elders wanted to see me. I couldn't understand why I was being sent for, and I was scared. I was a single woman, and a woman with no husband has to be very careful. The panchayat told me they'd selected me to be trained by the project people as the health worker for our village. I think they picked me because they didn't understand exactly what the job meant. The project people told me they didn't know much about the people here, so they needed someone from the village itself. They wanted me to come to the hospital at Jamkhed once a week. They said they would teach me about nutrition, family planning, tuberculosis, polio, leprosy, and other diseases. My job was to come back and share this knowledge with the other people in the village. I thought about this and agreed to become a health worker.
आता काय पाणी पाजत असतं का? हा? आणि किती महिन्यात झाले आता? 16 तारखेला 2 महिने होते. 2 महिने होतील का? बरं. बरं मग आता तुमची तब्येत कशी काय बरी आहे ना? बरं मग तुम्हाला मला वाटतं थोडंसं
ಸ್ವಲ್ಪ देऊ का?
The first time I went to the hospital at Jamkhed, I was very nervous. I'd never been to a hospital before, and I didn't like the smells. And I wasn't used to being in the company of men.
आणि डॉक्टर बाई आणि डॉक्टर साहेब दादा जर यायचं म्हणलं तर आम्हाला नुसतं काटं फुटायचं अंगावर. बाई आता कसं काय बसावं त्यांच्या समोर म्हणजे माहितीच नाही ना आम्हाला बसायचं.
काढा चष्मा काढा थोडा चष्मा कर सिस्टर अगदी हे पहा हां थांबा 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 खाली पहा बरं डोळे स्वच्छ आहे का डोळा आता दोन्ही डोळ्याचं केलं आहे ना बरं टाके पडलेत ना त्याची खाली ठीक आहे लाली वगैरे काय नाही हां तसंच ना करू हात करा फोटो करा
चांगलं झालं हां चांगलं झालं
थांबा थांबा दोन्ही डोळ्याचं आता आजोबा समोर हे आहे बरं का आरसा समोर आरशाकडे पहा घाला डोळा वरती वरती घाला की लोक चष्मा आता समोर पहा कसं दिसतं जरा काय चेहऱ्यावर का उल्हास वगैरे काय आहे का देवाने दृष्टी दिली काय हसू बिसू आहे का डोळ्यावर काय
चांगलं आनंद झाला
कुठे दिसतंय
आनंद झाला हे ते दिसतंय
हे नाही
वरती वरती
वरती ऊन
समोर आरसा आहे ना
हा तो आरसा दिसतो
बाई दिसते का
कोणती ही बाई हा
बरं मोठा माझा
हे इथे हातात कुणाचं काय आहे
बरं शाबास शाबास माझा हसाव ना जरा देवाने दृष्टी दिली काय नाही उल्हास नाही जीवाला आपल्या
कम चांगलं झालं बाबा
जमा
आज तू
बरं बरं
नाही झालं
बरं आता चांगले झाले ना दोन्ही डोळे मिळाले मग का धरतोय त्याला
मोकळं चाल आता
बरं चालेल
Well, what has happened is I think the doctor has made the medical science very mystic and has tried to make it sort of all hush-hush and make the common man look up to the doctor as a god.
बर काय होते चाललं आता तुमचं कुठं गवत कापायला जातं का गवत हे कापायला जायचं बरं मग आता तुमच्याशी मला थोडं बोलायचं
To start with, I wasn't very confident about my ability to be a good health worker. People wouldn't listen to me. I tried to teach them about antenatal care and looking after young children. But people used to say, why should we trust this woman? How can she know anything? She hasn't even got a child of her own. One of my jobs is to deliver babies, and only women with children are supposed to attend deliveries. But some people trusted me, and because of what I'd learnt, mothers and babies no longer died in childbirth. Gradually, others began to listen too. Now I tell them all about vaccination and diet and hygiene. They understand about disease, and their children don't die anymore.
Most of the diseases that occur in mothers and children are attributed to divine curses. Divine curses because the mother did not behave herself, because the woman did something when she was unclean, and therefore she has been cursed. And so the solutions to disease that people take is to go to divine healers, and they have to sacrifice goats or chickens, and they have to spend a lot of money because they think that God is angry with them.
Nelson, I think it's time to switch, isn't it? We're cutting some of this out because it's too long to get within the Sunday school time, so I'm abbreviating a little bit of it. So apologies, but that's the constraints we work under. Except we've lost the whole video now. Nelson's working hard to get it back up.
Do you want to say anything more, or you want to skip ahead to the
No,
next
yeah,
point?
skip ahead to the next piece.
Okay, give me just a moment.
तरी काय एक हे साळगाची समजा काय काम आहे त्यांना इरबळ काय करावेल नाही संध्याकाळी आपण जाऊन करायचं परत मग जी प्रकल्पातून जे आम्हाला साळबाईंनी माहिती दिली ना त्यांच्या मागे जसं आम्ही साळबाई कशी धट्ट झाली तसं आम्ही पण धट्ट व्हायला लागलो होतो थोडं थोडं असं वाटतं आम्हाला आता काय पुरुषाची सुद्धा भीती वाटत नाही जास्त किंवा काही असं करून भुरकाजी घेतात ते काय घेत नाहीत आपण नाही तर मग पुढं असं वाटायचं की कुठे बाहेरच निघू नये असं वाटायचं
आणि सुखमान मुले थोडी संसारात गोडी कुटुंब नियोजनचा महामंत्र ध्यानात ठेवायला पाहिजे आणि रूप बसवलं पाहिजे संतनी आमच्या गोळ्या खाल्ल्या पाहिजे म्हणजे आपल्याला जास्त मुलं होणार नाहीत महिना पण गाव कारभारी हे ऑपरेशन केल्यावरती अंगातली शक्ती वगैरे कमी होती का अगं महिने आपल्या गावात पुष्कळ बायाने ऑपरेशन केले त्या पाणी त्यांच्यात घरचं काम करतात एकटाच जातात आणि आपल्या नवऱ्याला मदत करतात तेव्हा ऑपरेशन केल्यावरती कसल्याच तऱ्हेचा त्रास होणार नाही तू आपल्या गावातल्या महिला मंडळात जाऊन सांग
त्याच्यानंतर कुटुंब कल्याण की आता लोकांना असं कळून यायला लागलं की मुलं वाढली मग का शेती वाढली का असं ही एक अडचण त्यांच्या आमच्या दूर होऊ लागल्या
आम्हाला आता मुलांना 4 झाली ती बस झाले आणि ऑपरेशन केले की आम्हाला वाटतंय आता शेतीला मुलांना वाढवा मग का शेतीला वाढवाय का 4 मुलं आहेत मग काय शेतीला किंवा कमाईला काय वाढ नाही किंवा आपले 4 मुलं ती थोडे बाजूला संसार छोटा की लय जरी मुलं असले तरी त्यांना कशाचं आणून घालायचं किंवा कुठून काय करायचं आपली काय एवढी ऐपत आहे का म्हणजे आम्ही दोघांच्या विचारांनी ऑपरेशन आमच्या मालकाने करून टाकलं की म्हणले बाद झाली आपली 4 मुलं 2 मुली आणि 2 मुलं
किती सोपं ऑपरेशन
सुरुवातीला मी ऑपरेशनला गेले तर माझा मालक रानात आऊत आणत होते त्यांना माहितीच नव्हतं गेलेले मग कोणतरी पोरांनी जाऊन सांगितलं की म्हणलं तुझे माणसं ऑपरेशनला गेले ते आऊत सोडलं तिथं आणि तिकडं आले माझ्या पाठीमागं म्हणलं तू का ऑपरेशनला आले मला तिथं तक्रार खेळले त्यांची माझी तक्रार झाली घरी आले तर दुसऱ्या दिवशी इथं गाडी आली आपली प्रकल्पाची आले तर त्या ढिलपी बाईला काय म्हणतात बाई तुम्ही माझी माणसं का बरं नेले ऑपरेशनला मी तुमच्यावर फिरात करतो आता की मला 2च मुलं, 1 मुलगा आणि 1 मुलगी, आणि तुम्ही माझी बायको ऑपरेशनला नेली, मी तुम्हाला आता तुमच्यावर काहीतरी फिरात करतो. ती मला येऊन तिथं बाई म्हणाल्या, तू का ग तुझ्या नवऱ्याला विचारून नाही आली? परस्पर आली तर आम्हाला किती तुझा नवरा बोलला बरं, तू परस्पर यायचं नव्हतं. तर मी म्हणलं त्याला जर म्हणलं लय मुलांची आवड असली तर दुसरी बायको करून म्हणलं त्याला म्हणा की तुला किती पोरं करायच्या तेवढे कर, मला एवढे बाद झाले पोरं. तर मग ते घरी आल्यावर म्हणायला लागलं ऑपरेशनला गेली, कुणाचा विचार नाही घेतला, सासूचा नाही, सासऱ्याचा नाही. म्हणलं सासऱ्याचं काय, म्हणलं पाळण पोषण करायचं काय त्यांच्या हातात नसतं. लय जर मुलं झाले तर काय ते काय आपल्या संसाराला काय मदत करणार नसतात. उद्या जर मरून गेलं तर काय त्यांच्या मागं जाणार का आपण? ते मुलं बाळ घेऊन जा म्हणायला. आता लय जर मुलं झाले तर मग ह्याला काय करायचं? कपडा एक भेटाना, अन्न एक भेटाना. आणि म्हणलं जर तू मला जर लय हौस असलेली आहे मुलाची, तर म्हणलं जसे बाजारात जसे गुरु येतात ना लय मोठे, तसे तेवढे पोरं करा आणि त्या बाजाराला हाकून न्या, म्हणजे हे पोरं लय मोठे दिसतात. मला एवढे बाद झाले 2 पोरं.
You have anything to say, Henry, or should I skip?
No, just, yeah, skip it straight forward.
आपापल्या गावी यायचे आणि चालायला लागत. आता आम्हाला इतका विश्वास आलाय, आम्हाला एवढा कॉन्फिडन्स आलाय की समजा उद्या डॉक्टर आरोळे किंवा ग्रामीण आरोग्य प्रकल्प आमच्या जवळ जरी नाही आला किंवा त्यांनी आमच्याकडे दुर्लक्ष केलं तरी आम्ही स्वाभिमानाने आणि व्यवस्थित जगू शकतो. अशा प्रकारे या तरुण मंडळाचा आणि या प्रकल्पाचा आम्हाला फायदा झालेला आहे आणि आम्हाला माणसं म्हणून जगण्याचा, माणसासारखं जगण्याचा आणि माणसाला कसं जगवायचं याचं शिक्षण मिळून आम्ही त्या दृष्टीने तयार झालेलो आहोत. आणि प्रकल्प यापुढे नाही आला तरी आम्ही चांगल्या प्रकारे आमचं जीवन जगू शकू एवढी आम्हाला खात्री वाटते.
Well, I think it is very disappointing that somehow most doctors have taken upon themselves the task of curing diseases as their important business. And by and large, we in medical profession are forgetting that our most important task still is to educate people how to cope with their illnesses or how to live in the surroundings in which they are placed.
It's true that we are working in a very small area. It's sort of a drop in the ocean. But even in these small areas, when I see the potential that there is in these people, especially in the women, I feel something can be done. What happens is that very often we only think in terms of material goods, that we do not have the money and the education and the technology. But our real richness is in people. And I believe that if people are given the opportunities and if people are given the trust, then they can rise to the heights and they can develop. And I think this is what we are really trying to do, and we feel that by putting our trust in simple illiterate people, we can make them rise to the highest.
Okay, Nelson, you can cut that off now. So let me go back to my PowerPoint if I can. Can you see that?
Yes.
Yes.
Yeah. Okay. So I'm curious to hear your reactions to this.
I thought it was wild to me that like certain people are, I mean, I know the caste system in India I like fundamentally disagree with, but like you're not even allowed to use the same water pump. That's just, I would not do well in that society.
Right.
And then I'm like, what do they do if you use it? Screw you, I'm going to use the water pump.
Yeah, the social norms in that environment are quite extraordinary by our own standards today. So the fact that the Aroles were able to work within that system and change it is it's kind of revolutionary in a way in how they did it. Any other reactions?
I was wondering why they chose a woman who was an untouchable to be the village nurse. Was she, if they wouldn't even allow her near the village well, how was she? Because as I understand it, untouchables aren't even allowed to touch anybody that is of a caste above them. So was she working just with her own people, the untouchables, or was she able eventually to branch out and help?
Yeah. So that was part of the genius of the Aroles. They, well, first of all, a lot of these initial village health workers had been women who had been outcast in the community, not only because they were untouchables, but because a lot of them had had a serious illness like TB. And the Aroles sort of, through their medical help, they got them well again. And then they gave them this opportunity to be of service to their community. But the genius of it was that the Aroles gave them confidence. They gave them the teaching and the confidence, and they also backed them up when they had a problem. And so within the community, they gradually became accepted. It didn't happen overnight. And so it's part of the genius of their work that they were able to give priority to the untouchable people and break down the caste barriers that existed within the community. It didn't happen overnight, and there were a number of ways they did this. Just as a small example that comes to mind at the moment, they would invite villagers to come to the central compound in Jamkhed, and they would have them all eat together and then sleep together, which is unheard of within the local village. So it was an example of how they gradually broke down these caste barriers and enabled the untouchable women to be valued healthcare workers within the village.
Well, that's what I keep thinking about, Henry, is that, we sometimes take for granted that compassion doesn't have boundaries, or it ought not to. And oftentimes, actually, what happens when real compassion is engaged and real kind of action through compassion is engaged, it actually brings barriers down. And it's very gospel centric. I mean, this is what Jesus was doing all the time, is just trying to break down barriers by demonstrating a different kind of justice and mercy and love and compassion. And it seems so radical. And I think that's what's disappointing, is that something that ought to be, wouldn't it be nice if it was commonplace, is actually kind of radical demonstration of something. But it also reminds you that there's this kind of compassion in action happening all over the world in ways that we just don't totally understand or can't imagine, but it tells quite a remarkable story. So,
right. Well, this movie was made in the early 1980s, and I mean, it's extraordinary that even today we haven't been able to provide the sorts of support and programs to people like this. I mean, there's been a lot of progress, but there's still an enormous amount of work left to do. So in that sense, the Aroles were pioneers in public health, if you want to call it that, pioneers in community health. Just one side comment, and that is that Western medicine, as we know of it, has been focused on highly trained people, physicians and graduate nurses providing services in a facility. And that just was not making progress in reaching the needs of people around the world at that time, and it still isn't. And so, in that sense, what the Aroles did was pioneering, still is. But any more thoughts to extend what Ryan was saying about the Christian nature of the work? I mean, the Aroles were deeply Christian people, but they didn't proselytize, they didn't advertise their Christian faith, but it's what they did, of course. But any other thoughts about the Christian nature of this work here?
An example of preaching the gospel always, using words only when necessary.
Yeah, yeah. I read this. I read this quote one time. It said, uh, "Your actions are so loud, I can't hear what you're saying." Something like that. Yeah. So, one of the things that strikes me in this is, which to me is a deep foundation of our Christian faith, is the concept of the dignity of all people. That's Jesus' whole ministry reflected that, and to me that comes through in this video here of what the Aroles were able to do, and they recognize the strength and the capability that all of these people had, even if they were untouchables, and provided them with the motivation and the encouragement to be the people that they had the capability of being, but they didn't know it.
Or they weren't allowed to do it.
Right. Absolutely. Absolutely. Well, I want to move on here. If I can. There we go. Apart from what the Aroles did in that in their own area of 70 villages, and by the way, this is the decline in the infant mortality that they were able to demonstrate. That's in their book. Extraordinary improvement in the actual health status of the people that they were working with, and there are many other statistics I could show you how they eradicated malnutrition, expanded the use of family planning, and so forth and so on. So it was a very dramatic achievement that they made in medical health statistics, not only the human dimension of the people and the transformation of the people. I was in John Kett in September with Marilyn, and here you see the people to my left in this picture are the son and the daughter of Raj and Mabelle Arole, who run this now. And it's extraordinary to see this program still operating, still doing the same kinds of things that the Aroles started. And it's been an extremely influential activity. Here we are with one of the original community health workers that we went out to visit and hear her tell about her career as a community health worker. But aside from everything that we've seen, the contribution of what the Aroles did was really extraordinary in other terms as well. Their program was one of the very first community health worker programs in India, and in fact in the world. And Raj Arole was on a small committee that was called by the Prime Minister that led to the introduction of what is now the world's largest community health worker program in the world. In India, there are more than 1 million of these female accredited social health activists they call ASHA workers. And of course, that in and of itself has influenced other community health worker programs around the world, which are now quite strong and growing, still a long ways to go, but they've come a long ways. I say here in this second bullet that they influenced a new vision for global health and primary health care is exhibited by the Declaration of El-Mata. I wish I had more time to explain this, but there was a world conference. The first world conference on health that was ever held was in 1978, sponsored by the World Health Organization and UNICEF. And the work that the Aroles had started was, in my view, the most important element that led to a whole new vision of primary health care that's reflected in the work that the Aroles did. And so we're still following this vision is contained in this 3-page declaration, which is an extraordinary document. 45,000 people have come to Jamkhed for training that the villagers themselves provide. 3,000 from other countries, 42,000 from India. I mean, that's an extraordinary thing in and of itself. And the Aroles set this up so that people would come there, but they would go out to the villages, and the local villagers and the community health workers in the village would work with these people and tell them what they're doing and so forth. It was very inspiring. And then the book has become a classic throughout the world, as I mentioned as well. This was what I was able to find out about Mabelle Arole's father, who taught at Duke for a short period, but not very much more that I could find out about him. But obviously, somehow, some of what he did rubbed off on Mabelle, who was an extraordinary woman and very dynamic and very intelligent and deeply committed. So these are a few of the spin-offs of my relationship with the Aroles. And it's, you know, I've had a very special life in so many different ways. And one of the ways in which my life has been special is that I've been able to meet and know people like this. I considered them my friends before they died, and have always been inspired by people like this. And I think in these days of darkness, we need to remind ourselves that there are people out there that are doing the Lord's work, and it's not easy work, and they need our help and support, and we need to uplift them in ways that we can. And so I hope this has been of some interest and value to you. It's a little bit out of the ordinary, I guess, for our usual adult forum sessions, but still, to me, very much in line with what we're trying to do in terms of expanding our faith and building our discipleship as followers of Christ. I've got maybe 4 or 5 minutes left, so I'd be interested in any other comments that you all might have. I'm going to stop sharing the screen here.
Well, that was such an impressive chart showing the decrease in mortality.
Absolutely, absolutely.
With clean water, vaccines, and basic preventive care. You know.
So, you know, one of the common things that people mention in my global health world is that you know, why haven't more people done this? And one of the responses is well, the Aroles were extraordinary people, and you know, not anybody can do this. But I think it's still an important question is why don't we have more rollies out there doing what they did?
There's a quote that you all probably know from Jimmy Carter that says, "My faith demands that I do whatever I can, wherever I am, whenever I can, for as long as I can, with whatever I have to try to make a difference." Um,
Which comes from John Wesley,
yeah,
his statement. Anyway.
yeah. But it's this reminder that you know these are people, John Wesley, Jimmy Carter, who have a particular standing and status. But it's a reminder, that we don't always know what we can do or what it is that we have to offer, and not all of us are doing global public health, but just we all have something we can do where we are, and I think we become afraid of, or not even afraid. We just don't always see what we have that makes a difference, and these are people doing things in a remarkable way that makes a remarkable difference in one part of the world. But it's always a challenge and an inspirational one, I think. And stories like these of what's mine to do where I am, what can I do where I am? And I think if we all took on that mantle and that opportunity and that challenge, the world would be and is in many ways, there's a difference being made every day, everywhere. But um, the demand of us to do that is, I think, the reminder that it's not just worth considering, it's something that's demanded of us. But I think we need stories like this to remind us that, okay, what's mine to do where I am with what I have for.
Right.
So,
I've thought about this a lot, and for those of us who are midlife or later in life, it's very difficult to change gears in some radical kind of way, and that's one of the reasons why working with young people and giving them a vision of what they might could do is so important, because they're not locked into all the constraints that we have later in life. But having said all that, there's still a lot that we can do later in life that doesn't require radical refashioning of who we are and what we do, that can still be helpful. Well, it's 10:45, I think. So thank you for joining, and it's been a pleasure for me to share this. I stumbled across this movie maybe a year or two ago. I had seen it a long time ago, but it's a masterpiece. I don't know how they did this, to the quality of it and how they were able to get everybody to cooperate and to talk like they did. But that's certainly not a small achievement, and I think it's a movie that's worth sharing more often.
Yes, thank you, Henry, so much. That was really moving.
Well, if any of you want to see the whole movie itself, it's 48 minutes long, and so the link is there in my PowerPoint. So that's available to you if you're interested. So thank you so much.
Thank you.
Thank you very much.
I'd like to see it. Can we get it dropped in this chat or distributed somewhere?
Oh yeah, sure. Let me do that right now if I can. Okay. Well, thanks so much. I didn't realize you were here, Doug. Yeah.
While you work on getting that in the chat, let me just plug, if you are interested, in about 15 minutes, in lieu of worship in person today, we have another Zoom link that was sent out. I'm going to lead the congregation. Anybody who's interested in just a prayer time. Some of it will be guided, some of it will just be open. And it's not intended to be very long, but just an opportunity for us to be together. So after you log off this Zoom, at 11 o'clock, you can log into another one if you would like. There's no pressure to do that, and if you need that Zoom link and didn't get it in the congregation-wide email that went out, you can email me or just email congregation@duke.edu, and I'll see that, and Karen Rhodes will see that, and our new administrator Catherine will see that, and we can send the Zoom link out to anybody who needs it. But or I can send it to you now in the link in the chat as well.
Yeah.
But just another opportunity to be together in a few minutes. So
I'm technically challenged to find this and get it in the chat box in this moment. So I'll send it to Ryan and Nelson both. So anybody who wants it can get it from there.
Yeah, we can distribute it.
Send me an
Sure.
email directly if you want. So thanks a
Sure.
lot. Okay.
All right. And
Thank
while
you.
Ryan's sending that, I just want to do a little outro for next week. So if you can please join us next week as we welcome Dr. Don Courtney, a geriatrician and palliative care physician who has devoted over 4 decades to caring for elderly patients and mentoring the next generation of physicians, and over 3 decades to being a very cool dad. Dr. Courtney has pioneered gerotrauma consulting services, helped expand hospice care beyond traditional cancer patients, and founded the Palliative Medicine Fellowship Program at Grand Strand Medical Center. He will present The Last Thing on My Bucket List, exploring how we approach death. Since we all face this universal experience, why not face it with knowledge and intention? Dr. Courtney will guide us through the options and decisions we can make now to ensure greater comfort and dignity at the end of our lives. So
seems like a neat
he's my
setup.
dad. Yeah, he's a cool guy. Please come or join in Zoom. It would make me very happy and him very happy.
Yeah, and he was at the adult forum a couple weeks ago. Some of you may have gotten to meet him like I did. So
Yeah.
thank you.
Yeah, and I just saw that Nelson put the link in there. Thank you,
Yeah.
Nelson. You beat me to it.
Yeah.
Is there
So
And I know the adult forum last week was postponed because we weren't able to do that one virtually for some technical reasons. I know that's been rescheduled for a post-Easter time, I believe. So we'll get Ben Weschler back up on the list for April sometime. So
okay.
Is there any is there any way that these adult forums could be recorded and like I can't ever attend because I have to usher
yeah,
it.
they are recorded. That's a good question. And they're on the congregation's YouTube channel. And if you ever need help getting there, just let us know. But all of them, as long as there's permission given for whether it's, a personal reason or a copyright reason or something, unless there's a reason not to, they're all recorded, as are the adult Bible studies. And we put them on, we try to make sure they're up on the congregation's YouTube channel. So if you ever have a need to find it or can't find one, let us know. But I do know a good effort is made. Like today's was recorded and will be posted. So that's a great question, Eileen, because not everybody can attend these all the time. And so we try to make them accessible.
Thank you. I had never read in any of the congregation newsletters that they were accessible. So
That's a good, maybe we need to highlight that in an upcoming e-news of, hey, did you know? And here's the catalog of how to go back.
Right.
Because that's a great, thank you. I mean, that's a great reminder of helping people know these are available because they're great things to check into. So
thank you.
And we can add it to the congregation website a little more easily too. So
Great.
Cool. Well, thank
Okay.
you all.
Thanks, everybody.
Thank you.
Be well.
Take care.